An important deadline is approaching. Open enrollment for the Affordable Care Act ends December the 15th. Enrollment for Medicare is happening all this year, but there are some tricky times you need to know about. There's still some things you need to know, especially if you have prescriptions. You probably hate paying out of pocket for them. There is a way to get them for cheaper. Today, I am joined by Chris Alvarez from All Insurance for You, as well as Christopher Cook from Alliance Insurance Services. And we're going to be talking about the Affordable Care Act, Medicare, and prescription questions. So what you can do is you can text them your questions. We're going to put up the number so that you can see it. It's 336-379-5775. You can also see that number at the bottom of your screen. All right, guys, so from what we know, the Affordable Care Act, the enrollment ends December the 15th. Chris, if people don't make that deadline, what happens?
That's a good question. Well, what could happen is you're in the lockout phase where you're not able to enroll into the Affordable Care Act. The only way you would be able to enroll is if you qualify for a special enrollment period. Now, there are different circumstances that you may be eligible to enroll in a special enrollment period, such as you lose work coverage, you lose Medicaid, you get married, upon others.
Okay, so there are ways for you to get health care if some kind of big life experience happens. But if you just miss the deadline for just missing the deadline, then you will be without health care for an entire year. Is that correct?
That is correct. Through the Affordable Care Act, they set those guidelines and deadlines to enroll into the Affordable Care Act.
All right, so this person is asking, what is the minimum that I have to earn to qualify for help through the Affordable Care Act? Is that a Chris or Christopher response? I know, Chris, you had income levels, you had a whole chart at one point, is that right?
That's correct. It really just depends on your household income and size. So for an individual who's single, the income for 2021 is $12,760.
So say that one more time for me.
Yes, for a household of one, single individual, $12,760.
Okay, that's for one. And of course, it changes as you add more people to your family. All right. So this person is asking, if I continue to work, do I have to enroll in Medicare? Can I enroll when I retire and not be penalized? Christopher?
That one actually might be a little bit better question for Chris, but you need to go ahead and make sure you have registered. You can defer if you so choose, but Chris, Part A you need to get enrolled in, and you can choose to defer and then pick up when you choose to retire. Is that correct?
Yes, that's correct. You're automatically enrolled in Part A. Part B is where you have to sign up or enroll. Now, I will say that it's important to look at your work coverage and compare it to what may be available through Medicare. Sometimes it's beneficial to stay on work coverage because there are certain limitations that don't apply to you, including medicines, copays, out-of-pocket expenses. But it's important to review all avenues of approach.
Okay, and I know that we have a graphic that shows folks when they have to sign up for Medicare. So guys in the back, if we can kind of get that ready so that we can show it. There is a timetable, and you enroll for Medicare the month of your birthday, 3 months before, or 3 months after. So you have a 7-month time span to actually enroll in Medicare. And if you don't enroll in Medicare during that time, it could cost you some really big bucks. Okay, so we've got this graphic up so everybody at home can see it as well. Again, it's the 3 months before your 65th birthday, your birthday month, 3 months after. And if you miss that window, you will pay a 10% penalty every 12 months for the rest of your life on premiums. Christopher, I see you nodding your head like, who wants to pay any more money on the premiums?
Yeah, you can get yourself in trouble by not checking with a professional to make sure you do that correctly. There's also concerns around Part D as well, which is your drug plan. So folks who are seniors or who are approaching the magic age currently of 65, just please get with an agent who can help you explain all that. The federal government and the state government provide quite a bit of information in regarding this topic as well. So the information is out there, but but you do need to be careful and consume that information and be informed and educated about the topic.
Okay, so you can go on the Affordable Care Act and you can look at all of the plan comparisons yourself and try and figure that out. That is definitely something that you can do. But a lot of people will say you need to go to an independent Medicare provider so that they can help you with that. Chris, how does that help folks?
So from the Affordable Care Act standard, there's a lot of information that goes when you're applying. It's really good to sit down with someone and discuss what your income is, what types of avenue you go as far as selecting a doctor or a plan. Each plan is different, different networks, different benefits. So it's really important to sit down, do your homework, and just sit down with an agent who can really help you and guide you in the right direction.
And they can help you with the Medicare as well. I wanted to lump both of those in. All right, we're going to continue to take your questions. We'll be right back with another few moments of your health care plan enrollment questions.